Hello and welcome to our show, Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Now, the pandemic has put mental as well as physical health and wellness into sharp focus. Throughout the pandemic, several coronavirus variants have emerged as the virus continues to mutate and evolve. In November 2021, a variant of the SARS-CoV-2 coronavirus emerged and was named Omicron by the World Health Organization. Even if we have a virus that causes less severe disease, this virus can affect vulnerable and unvaccinated population. People with chronic diseases need to be careful about the management of their conditions during this phase. Medication adherence must become a priority as we deal with the continuing effects of the pandemic. It can affect both quality and the length of life and overall healthcare costs. It's important that individuals continue to take their medications as prescribed by their doctors to keep their conditions under control. For some people, medical adherence itself is a new term to discover. For some, there are many misconceptions about it. But we have with us today an expert panel to clarify all your doubts and answer all your questions. We're joined by Dr. Chimu Chinte, consultant endocrinologist and diabetologist, Chintamani Hospital, Jalgaon, and Dr. Sameeran Upasani, consultant physician, Nityanand Nursing Home, Kalyan, Thane. Thank you so much, doctors, for sparing your time and joining us on the program. Dr. Chinte, I'd like to start with you. The Omicron coronavirus variant seems to produce milder symptoms and fewer hospitalizations than Delta. Is this because most people have been vaccinated? If you could tell us.
Yes, actually, in the recent data till now, the Omicron is producing very mild cases and it is involving only upper respiratory tract infection and not involving lungs and causing severe cases and few hospital admissions. Those people who are getting vaccinated, completed their vaccination schedule, those also getting the less severe infection and few admission rates. So it is urged to people to complete their vaccination schedule. Even now the booster dose, those who are eligible, they can take booster dose and use the usual protocols like hand hygiene, then mask, wearing masks and avoiding the crowd.
Right, but it's not a reason that people should take it casually as well, isn't it?
Yeah, people should not take it casually because we don't know, because still recent data, we don't know the upcoming data.
All right, Dr. Upasani, what is a vaccine booster dose? Because that is something that's really come into focus now. And how does it help boost your body's immunity towards COVID? What is the difference between a vaccine booster and a third dose of the vaccine?
So basically there are two parts. What is the definition of booster dose? So booster dose is defined as an additional dose to the person who has received the priming dose or the first dose. So when a vaccine comes into the market for its use, it's extensively studied for safety and efficacy. And during that long period of say 5 to 6 years, you understand that 2 doses are good to give a good immunity or 3 doses are required. And sometimes you see that the vaccine schedule will be different for different vaccines. So I would like to give example. The good old smallpox vaccine was a single dose vaccine and nobody received any booster dose. The present day rotavirus vaccine is given 3 doses. And we all know that the polio virus, the oral polio vaccine, many people have received many doses, the children especially. And say in case of rabies, you initially give 5 doses. And that the 3rd dose or the 4th or the 5th dose is not called the booster dose. But if you have a dog bite, say after 5 years of taking the vaccine, you have to take 1 single booster dose. So for the COVID, all the companies which launched the vaccine, they made their own design. But now they are realizing that the study is going on and the antibody titers are going down and people are getting reinfected. So they now plan to give a booster dose. So the booster dose is the 3rd dose in case of COVID.
All right. Dr. Chinte, do people with diabetes need to change the dosages of their medications or, stop any medication temporarily if they're suffering from an Omicron infection?
Actually, those with, it depends on the patient's symptoms and severity of clinical illness. If patients are having less severe symptoms, mild symptoms, and they are home isolated, it is not needed to change their medication or decrease the doses. Only in case of they are having severe anorexia, That means if their appetite is severely decreased, they can consult their respective doctors and they can decrease the medication accordingly, but don't decrease the medication or increase the medication. In fact, those who are having severe illness and severe symptoms, those who are admitted and requiring various supports like inotropic or ventic support, they should be changed. They should be changing their medication as per the medical experts under which they are admitted. And some medications like SGLT2 inhibitors should be avoided in moderate to severe cases in diabetic patients. So, but it is always to be discussed with their respective doctors. It is always better to avoid the self-intervention in changing the medication.
All right, Dr. Upasani, many people are, unaware of the importance of medication adherence. If you could talk about that, so could you explain just what is medical adherence and why it's critical for people with chronic illnesses such as diabetes and heart disease to take their medications on time?
So the medical adherence is the degree to which the patient agrees or does what the doctor has advised. So that means how compliant the patient is. And it should not be restricted to only the medication. It is the lifestyle changes which the doctor has advised, is the diet what the doctor has advised, is the frequency of medical tests what the doctor has advised, is the frequency of visits that the doctor has advised. So the degree to which patient complies to the doctor's advice actually benefits the patient. So I would like to give few examples. Nowadays we are moving ahead with this electronic medical record and all the OPDs are going through the electronic system. So once you type revisit after say 60 days, usually a message goes after 58 days, say 2 days prior, that you have an appointment fixed with your doctor after 2 days. So this kind of practices, this kind of adherence improves patients' follow-up and thus patient gets better service from the doctors. The medical adherence depends upon the entire team. How good the doctor is, the communication skill of the doctor, the communication skill of people working with him, how they explain to the patient. And it also sometimes depends upon the socio-economic status of the patient. That is about medical adherence. Thank you.
All right, so it's important to, follow your medical routine and adhere to the medication that you have if you have to be treated, and remain healthy. Dr. Chinte, poor adherence to medication in both long-term and short-term conditions increases the risk of morbidity, mortality, and cost of care. What are the challenges faced by patients in adhering to prescribed medications, and what are the dangers if they don't adhere? If you could, elaborate on that.
The main challenges faced by patients for medical adherence, as explained by Sir very well, that is mainly the pill burden. That is, pill burden, we call it as the number of medication prescribed to the patient and the frequency of that medication. So patient feels, if it is a heavy burden, then patient, mostly the elderly people will feel it is difficult to take medication on time and with that frequency. Then second challenge is the cost of the medication and the side effect profile of the medication. If a patient gives all the information regarding their previous medical illness, whatever the previous medication and their poor socio-economical status, if they inform these all things to their medical practitioner, then it is always easier to prescribe the combined medications which are suitable for patients according to their side effect profile or according to their side effect profile and according to their economical situation. So with these three challenges, we can minimize the poor compliance and decrease the complications such as diabetes, which has long-term complications like cardiovascular disease, then brain stroke, it is there, then some problems related to the diabetic foot. We can all minimize diabetic kidney disease. We can minimize all the problems with proper compliance and adherence to the medication.
Right. And Dr. Chinte, what would you say to patients? Sometimes people realize they've forgotten their medication and then, they take both the medications or, they miss out. So what would you advise if you've forgotten the medication? What should you do?
So if they forgot the medication, they can continue the usual medication. They don't combine the medication with the next time. If they forgot the medication in the morning, it is not recommended they should combine the medication in the next time. They can follow their schedule in the next day. It is always very dangerous situation if they combine diabetes medication, if they forgot morning medication, they took both medication, morning and afternoon medication at a single time. They can land into the severe complication like severe hypoglycemia, and patients can have sudden death, sudden myocardial infarction, sleep and coma. So they should avoid this condition, and if any problem, any doubt, they should consult their respective doctors before doing anything on their own.
All right, so definitely don't double dose yourself. We'll slip into a short break now, doctors, and come back and take a look at how maybe technology can help in medical adherence. Stay with us. Welcome back. You're watching Health and Wellness, Myths versus Facts, and we're talking about medical adherence as well as managing in this pandemic with a new variant. Now, technology is playing an important role in the medical management of chronic illnesses. Dr. Upasani, if you could tell us, how can technology improve medication adherence?
Yeah, so since almost past 2 decades, the technology is gradually coming up into this medical field. And I believe in the next 10 years it's going to peak. So what are these smaller technological things that help patients? Okay, so we all are now probably using the smartphones. So companies are coming with various kind of applications. Say for example, if I have advised my patient to walk say 10,000 steps in a day, or say walk 5 kilometers in a day, so he can easily go on to a smartwatch, and that application in the smartwatch which is connected to the phone will give him how many steps he has got. So you yourself can understand that whatever advice that has been given by your doctor, you are following it through the app. Even the diabetic patients are now benefited by glucometers. So these glucometers are also connected to the smartphones by an app. And if suppose the sugar goes low, say it gets 50 or 40, suddenly a message goes to the concerned doctor, or the message can go to the concerned relative that his sugar is low. So he can call this person that your sugar is low, you have to eat something. So these kind of small technologies are definitely helping people to adhere to their medicines and preventing complications. Back to you.
All right, Dr. Chinte, now what is the importance of the HbA1c test for people with diabetes? How often should they get this done? Do these tests help people with diabetes lower their medication dose? And when should a person with diabetes ask his doctor for a change of their medicine dosage?
Actually, HbA1c, it is the 3 months average blood glucose level. It helps to give the average blood glucose over the and glycemic variation over the last 3 months. So it is long term, and it is actually ideal and it gives the correct estimate of the future complication of diabetes. If it is HbA1c uncontrolled since long time, then a patient can develop the diabetes complication like macrovascular and microvascular complications like myocardial infarction, then kidney disease, retinopathy and all these things. So at HbA1c, at least it should be done every 3 months in all the patients with diabetes, which can help to see the compliance of patient to the medication, whether patient is taking medication regularly, and also it will decide the efficacy of medication, whether the medication is working correctly for the patient, and it will help to decide the next treatment modality of the patient. And HbA1c target goal is specific for all patient age groups and depending on the clinical condition of the patient. Accordingly, we have to decide the HbA1c goal, and according to that goal, we can decrease or increase the medication and change the medication accordingly.
All right, Dr. Upasani, now many people with hypertension stop medication when, they feel their blood pressure has normalized. What are the consequences of that?
Yeah, that's a very important question, and that's a very relevant question. All of us in the medical field know that hypertension is the silent killer. Okay, it is attributed that if there are more than 100 deaths, in 80% of the people, there is some amount of contribution from this hypertension. So usually the scenario is that it is accidentally detected. You don't have much symptoms. Few symptoms might be some heavy-headedness or some headaches, but most of the times your blood pressure is on the higher side and you don't have any complaints. So it is picked up in an accidental checking or a routine checking. So normally when such kind of patient comes, doctor sees him, he advises him few changes in the diet. Probably if the blood pressure is very high, he also starts him on certain medications. In probably 1 or 2 visits, doctor reaches a dose which is good enough to control his blood pressure. And if there is doubt, he can also go for certain gadgets, recording his 24 hours blood pressure. So with this kind of things he controls. But what happens is someday patient records a blood pressure at some different point, say in his house he records himself or some other doctor he visits and they say that you don't have blood pressure. Actually, the tablets which he has consumed is actually maintaining his blood pressure to a normal level. But it is usually misunderstood that his blood pressure is normal, he doesn't require the tablets. So such practices should be avoided. Now what can happen? Suppose if his blood pressure was very well controlled and he has stopped the medication. So 2 things can happen. First is the acute complication, means which will happen within days. His blood pressure will suddenly start rising. It will affect, what will be affect? It can affect his brain. It can lead to, say, a condition called as hypertensive encephalitis. What will happen? He will have headache, he will have nausea, he will have vomiting. He can become blind because of the rise in blood pressure. Okay, he can have strokes, he can have paralysis. If he has a say weak heart, he can develop heart attacks or he can precipitate heart failures. So these are the acute problems which can happen when suddenly the blood pressure increases. And if suppose somebody is not willing to take any tablet for blood pressure, even though he knows his blood pressure is high, he doesn't take, that will lead to generalized vasculopathy. So what does that mean, vasculopathy? The blood vessels going to organs like brain, heart, kidney, eyes, all these blood vessels, they get hardened, they get sclerosed, they get damaged. So eventually it leads to widespread damage all over the body. Thank you. Back to you.
Right. Dr. Chinte, now some people with diabetes, however, believe that if they forget to take their morning medication, as I mentioned earlier, that they can combine their morning and afternoon dosages. So if again you could, advise the people on this.
Oh, it is always very, as I said previously, it is always very dangerous to combine the medication morning and afternoon, or if they don't meet afternoon dose with the evening. So subsequent mixing of the dosing should be avoided because they land into the severe hypoglycemia symptoms, like their sugars can go into 40, 50 or 30 and patient can become unconscious. They can have sudden death at that point. They can precipitate myocardial infarction. Then heat can be there, seizure can be there. So many problems are there. So patients should always avoid combining the subsequent medication in the next time if they forgot the medication. It is always continue the usual doses as per listing if they forget, and they can reschedule their medication as per the prescription of the doctor from the next day. And if any doubt, they should call their doctor if they have any problem.
All right. And Dr. Upasani, why is it necessary to know blood cholesterol and lipid levels and how they impact our health and well-being?
So yes, all of us are consuming different kinds of food, and ethnically and as per different states in India, food patterns are different. Okay, so lipids or say cholesterol is a very important constituent of our diet. But I want to tell everybody that whatever kind of cholesterol you consume, say you consume ghee, you consume oil, you consume meat, any kind of cholesterol is broken down to the smallest level for it to get absorbed. Usually they are called as monoacyl glycerol or diacyl glycerol, or they are called as fatty acids. So our entire GIT, that means the entire intestine and stomach and mouth, everybody is involved in this breaking down of the fat. So whatever fat you eat is going to be broken down to the smallest level. This fat is going to get absorbed from the intestine and it is going to move to the liver. And in the liver, as per the needs of our body or as per the stress of our body, it is going to go into different parts and it is going to form different kinds of cholesterol. So for example, if you see a report, your own report, it will mention total cholesterol. So total cholesterol is nothing but the numerical sum of different kinds of cholesterol which is found in our body. Now we all know that the LDL cholesterol is a bad cholesterol. We know that the HDL cholesterol is a good cholesterol. Then there are other cholesterols like triglycerides, very low density chylomicrons. They are also slightly harmful. Now what is important is the manufacturing of different kinds of cholesterol in the liver is dependent upon your lifestyle, your level of stress, your level of exercise. Say suppose you are having very good sleep, say 7 to 8 hours of sleep, you are working as per your hours, you are not overworking, you are doing good exercise, then the HDL cholesterol level is higher, which gives heart protection, which gives protection to a heart, brain. And suppose you are working tirelessly, you are under tremendous stress, financial stress, all kinds of stress, then the LDL cholesterol starts going up. And it is harmful. The LDL cholesterol can go and deposit in various small blood vessels like heart, brain, kidneys, and can produce damage. So your report tells you that something is wrong. So you should do your lipid cholesterol level, and depending upon the report, you should consult your doctor.
All right. So important to get, all this tested, especially after a certain age, so you can deal with any, problems that are coming up. Thank you so much, doctors, for sparing time and joining us on the program today and answering all those questions. And thank you all for watching at home.